According to the medical report To Err is Human, published in 1999, it identified that medical errors are the fifth leading cause of death in the U.S. at that time, so it shows how prevalent they are. Preventable medical errors have many effects in healthcare, including causing patient harm. When diagnoses are either prematurely excluded or patients are misdiagnosed, they can receive unnecessary and potentially harmful treatment, or the misdiagnosis is causing them harm. This goes into another impact of medical errors, which is financial costs. When patients are misdiagnosed, they may have complications from the disease, leading to recurrent readmissions and increased length of stay. Another reason is it can decrease patients' trust in the healthcare system. When patients learn that they are either treated for something that they don't have or a diagnosis is missed, they may not want to seek professional help when experiencing future health problems. So deductive reasoning and inductive reasoning play roles in diagnostic reasoning because it's not they can help analyze patient symptoms, tests, and assessment to reach an accurate diagnosis. With deductive reasoning, hypotheses can be made about a diagnosis, and as more information is obtained, the diagnosis list can narrow down. For inductive reasoning, patients may present with symptoms that are similar to a specific disease pattern, and the provider can form a hypothesis about the specific diagnosis, and further analysis with deductive reasoning can narrow down the specific diagnosis, the specific disease pattern can make the provider think that it's a specific diagnosis that meets that specific pattern, and then from there they will have a broad list of diagnoses that it could also be. So active listening plays a role in diagnostic reasoning because it is not always clear what the patient is concerned about with their care. They may state their chief complaint but may not reveal what their fears are or thoughts, which could further guide the plan of care. Also, patients know their bodies best, so if a patient has had something happen in the past multiple times and a specific set of treatment worked best for them, it's important to listen to them. So, for example, I had a patient the other day who had a colon resection about 10 years ago and has had 5 short bowel obstructions since, and she said when she came in the other day it felt the exact same, and then in the past what worked for her best was Dilaudid for pain, fluids, and that she had not needed an NG tube in the past, so she would like to hold off on that unless it's absolutely necessary. So after CT scan, she did end up having a short bowel obstruction, and so that just shows that with active listening, you can help with patient satisfaction, gain trust, and increase safety because you don't know things about a patient unless you ask them specifically or you give them time to share their concerns and their thoughts, just like my patient the other day. So as a future diagnostician, to decrease the rate of preventable medical errors in the health system, I will use evidence-based medicine to aid my diagnostic process. I can use websites such as UpToDate to ensure I'm using evidence to support my decision-making and reasoning. And I can look for a second opinion in complex situations. I will also use active listening to ensure that I am getting the full relevant history.